Dr. Chelsea Azarcon. Welcome to the Tick Boot Camp podcast.
So excited to be here. Thanks for having me.
All right. And I'm also excited, not only because we have you, who we've been targeting for this podcast for a long time. So finally, we've been able to jive our schedules. But I'm also blessed to work for the first time with one of Matt Sabatello's favorite ever guests, Presley Taylor.
Hi, thank you for having me. I'm so excited.
I'm really excited to be co-hosting with you too today, Presley. So let's first make sure that I'm pronouncing your name correctly. So is it Azarcon, Dr. Azarcon?
Yep.
All right. And I hope you're not just being polite because I don't want to butcher your name.
No. You got it.
So Dr. Azarcon, where are you calling in from today?
Northern California.
All right. So welcome to East Coast time. By the way, Presley, where are you today?
Los Angeles.
Holy cow. So I have two West Coasters here and I'm on the East Coast. Look at how wonderful it is that all three of us can be together, even though we're on different coasts. So Dr. Azarcon, can you give us the name of your practice and what type of work you do and what kind of specialty that you have?
Yeah, so my practice is called Restore Naturopathic Medicine. So basically, it's an integrative primary care practice in Northern California. And so I work with a lot of things, but I obviously work a lot with Lyme and mold, environmental toxins, autoimmune, all of the lovely comorbidities we often see with Lyme, really chronic illness. I like to say I help people solve the symptoms that their doctors dismiss. And so there's a lot of things that come with that. But those would be the ones that are top of mind.
So before you go forward and introduce you and your background to the community, can you just give us a difference between a naturopathic doctor and an allopathic or a traditional medical doctor?
Yeah, I mean, a really simple way of thinking about it is naturopathic doctor is well care, and conventional doctor would be sick care. Of course, there's things in between. A lot of times as naturopathic doctors, we inherit really sick people that the conventional doctor doesn't know how to find what's wrong. And so we work with a lot of that too. But we're both board certified doctors, but naturopathic is looking at the whole person, the root cause, optimizing health, and not just throwing drugs at a condition to, ease symptoms. Not, I don't disrespect what conventional doctors do at all. That was actually a path that I was considering going down, but that helps clarify some of the differences, I think.
Yeah, one of the interesting observations that Matt and I have made is that most of the people who've been on a Lyme disease journey themselves and then pivot over to a career in medicine actually more of you are going to the naturopathic path rather than the allopathic or the traditional medical doctor path. Give me your thoughts on why that's the case. Why are more of you who have had Lyme disease during your childhood um, pursuing the naturopathic path rather than the allopathic path?
I mean, for me, it was very simple. I was able to learn the holistic tools that I knew I would need to get myself and other people better, faster going the naturopathic route than I was able to go to the allopathic route. And then there's also the issue of, if you go the allopathic route, you are in some ways owned by the system that you're working for. And even a lot of allopathic providers who are kind of coming over to a more integrative side, they end up leaving these systems and going into private practice because you really need to be able to have some autonomous decision making as a physician working with chronic complex conditions.
Well, and we're actually again we're seeing another pattern. Not only are doctors moving into private practice, but they're generally stepping outside of the insurance system.
Yeah, and that's a big piece of that's really tied into the allopathic path.
All right, but let's walk it back. We're gonna have some time, Presley and I, to talk to you about that piece of it. But just sort of spirit took me there for this moment. So we did talk about naturopathic versus allopathic doctors, and I do want to talk to you about a little bit more about terrain versus bug, and and maybe we'll talk a little bit about germ theory versus terrain theory because I think that's really at the heart of why I think so many young people who had been on a Lyme disease journey are turning to the naturopathic path rather than the allopathic path. And I think maybe it's one of the reasons why so many people who are sick with Lyme disease are turning to naturopathic doctors rather than medical doctors. So we'll again, I mean, allopathic medical doctors. I know you're a medical doctor as well, with an ND rather than an MD. But Yeah, let's go back. So are you a native of California or did you grow up somewhere else?
No, I am California native.
And what was it like growing up in California?
So, I mean, not what you would expect for someone who ended up being diagnosed with Lyme disease. I'm not sure if that's a spoiler alert or not, but um
Not on this podcast.
okay, yeah, that's what I thought. So, I grew up actually in a very suburban area, but we did, we went camping a lot as a kid. But I'm not someone who I look back on my childhood and go, wow, I had such obvious tick-borne exposures. I mean, when I was growing up, I think we really thought about tick-borne exposures being an East Coast thing for people who backpacked, and we didn't really think much beyond that.
So, and putting aside your tick-borne experience, what was it like? What kinds of things did you do? What kinds of goals did you have? And what was your vision for, how you were going to serve the world when you were a child? Did you think you were going to be an athlete? Did you think, for example, I thought I was going to be the first baseman for the Yankees, even though I'm not that good an athlete. We all have these goals and these dreams and these visions. So what did you think? What do you think you were going to be doing during your childhood? What kinds of things did you enjoy doing?
Yeah, that's a good question. I mean, when I was young, I was a pretty happy child. And then as I got a little bit older, I wanted to be an author, actually, nothing having to do with medicine. I wanted to creatively write. But I mean, I always kind of describe my childhood as a perfect storm for a chronic illness. My mom's experience when she was pregnant with me was extremely stressful. I was born into a pretty stressful home environment, just with some things that were going on in my parents' lives at the time. And then I had a traumatic, I mean, I had a sexual abuse event when I was a kid. And my mom, she's like, I didn't remember it until I was an adult. Actually, my mom always said, it's like somebody, like your personality changed when you hit first grade. And so that shifted a lot. And that's actually when I started noticing some of my health issues. I was a very colicky baby. And then also the vaccines were the highest in the amount of adjuvants the year I was born. So I'm not like trying to get into a vaccine discussion. I know I respect everybody's different opinions on that. But that was something that was just another drop in the bucket for me. And so, I really did deal with sickness pretty much from the time I was born, although I had some happiness that I carried with me until I had this traumatic event. And that really just kind of shifted the way that I showed up in the world a lot.
Okay. One of the things I'd like to explore with you, if you don't mind, if it wouldn't be too intrusive, is the traumatic event you just discussed. And the reason I want to discuss it with you is when we interviewed Dr. Richard Horowitz, one of the things he shared with us was that during the course of his career, where he's treated over 14,000 people who are suffering from chronic Lyme disease, that over 1/3 of his female patients had suffered a sexual abuse event in their lives, and that he saw a direct connection between the sexual abuse experience that his patients had during some time in their lives, and the chronic illness that they suffered. Can you, without giving us too many details, and of course, if anything makes you uncomfortable, please don't share it, but give us some more detail on that experience that you had when I think you said you were in first grade and how that impacted your health.
Yeah, I mean, so I was, I was sexually abused by somebody that was a trusted, as it usually is, somebody who was trusted, but also had access to me through the school that I was at. And one of the individuals kind of involved in giving this person access to like children ended up staying in my life. And so she kind of targeted me. There was the initial traumatic event, but then there was this person who was kind of continuing to target me. And so it perpetuated this trauma in my life. We were also in a very kind of small, closer knit community at the time. And so there was a lot of kind of interfering with this adult to try and shift the social dynamics of children that kind of developed and unfolded as I grew up. So a lot of that followed with me until I became too sick to function, and that happened around high school. But I mean, from the medical perspective, hands down, I not just with Lyme disease, but with any chronic illness, I absolutely believe that I think pretty much every single female I've seen with chronic illness has some type of stressful or traumatic event in their history, because, these people tend to be, their limbic systems are in fight or flight, which suppresses the immune system, and they a lot of times have these genetic SNPs that um, impact their personality. So they tend to be a little bit more permissive at first, or people pleasing at first. And so there's a lot of overlap between all of those things.
So talk to us about how you pursued your dream to become an author, and what did that mean from you, first from your educational and social experiences before you went to college, and then how did that impact your educational path, first to college and then to medical school?
Yeah, I mean, I didn't really pursue it. I would always say growing up, I'm gonna go to that my dad went to a school on the West Coast. So I wanted to go where my dad went, and I wanted to become an author, and I just felt very set in that path. And then around high school, I became too sick to function. I dropped out of high school, and I ended up I finished high school in 3 years, and I did it through independent study. And during that time, I was just trying to figure out what was wrong. I had had an uncle who had passed away, but he had been a doctor, and he had a Merck manual that I had. So I was reading that. I was reading, the Mayo Clinic had like a family diagnostic manual that I was reading. And then I started reading books about healing yourself naturally. And so I was just kind of consuming everything that I could, trying to figure out what was going on with my own self. And I mean, I was very socially isolated at that time, as many people dealing with chronic illness are. And so it just kind of became a pastime. And um, somewhere in there, I decided that I wanted to switch and pursue medicine. And I wish it was for something noble. I think, at that age, I was like, well, I know a lot about this and nobody listens to me. And if I become a doctor, then people will listen to me. So I was pretty young. But it ended up being, or pretty young reasoning there, but it ended up being a really good switch for me, because this has been a path that has allowed me to combine kind of the creative side of my brain. I think that's something people don't realize. There is a lot of creative problem solving and intuition that goes into doing a good diagnostic assessment, and that allowed me to pull in the more analytical side of my brain. So it's been a good marriage. And then I ended up actually becoming a published author after the trauma that I went through as a kid, of course, showed up in adulthood, and I ended up picking a narcissistic partner that I was in a relationship with for a long time. And so then after that relationship ended, I wrote a book about healing from that. So full circle.
So can you give us an outline of how your symptoms developed? And you gave us a very broad outline of having these challenges with the medical community, which then caused you to pivot to changing your career path to a medical path. And you said somewhere in there, without just to give us, so you were sick almost from birth. You had a traumatic experience in first grade, and then you got to the point where you couldn't function any longer in high school. So give us the development of those symptoms and how that symptomology interfered with your ability to pursue, at that time, what you thought was going to be a career as an author.
Yeah, good question. So, I mean, a colicky baby, and then as I got older and was able to talk, that got nailed down as lactose intolerant. So that was easy. They put me on rice milk, and I was kind of stable. Then I had this traumatic event happen, and I started getting stomach aches and headaches all the time. And I didn't want to go to school in the morning. I didn't really wake up with a pep in my step. And so my mom actually took me to an iridologist, which I feel
You
like
what?
an iridologist, which is a
What's that?
practitioner that looks in the eyes, and they basically say, like, here's what's going on based on the iris, what they see in the iris. So I don't know a lot of any of science behind that, but she was just trying to help me, and somebody told her, hey, this person helped me, and that gal put me on a grain-free, refined sugar-free, dairy, basically elimination diet, right back in the 90s, and nobody was doing that. So I did that for about 2 years, and I was really stable. I was doing great on that. And then, kind of that typical 90s mindset, you go on a diet and the diet fixes the problem, and then you go back. And I was a kid and I wanted to eat junk food. And so I kind of started eating more normally again. I mean, my mom was always as health conscious as she could be for the information we knew at that time. But I definitely still had access to not healthy food. So I started eating unhealthy. And then I definitely I didn't feel my best. I was kind of a stomach achy type of kid, IBS diagnosis. And then when I was in junior high, I went to the bathroom and I said, my pee looked like Coke, Mom. And she said, that doesn't sound normal. So, basically, long story short, I got diagnosed with IgA nephropathy, which I actually didn't even find this out until decently recently. The life expectancy on that disease is 10 to 15 years. That's an autoimmune disease that attacks the kidney. And I was probably 15 or younger at the time, and I'm in my 30s now, and my kidneys are, I mean, it's like I don't even have it. I don't even think about that disease. So, pretty amazing. But I got diagnosed with that, and then I started my menstrual cycle, and kind of typical heavy periods, painful periods. So my mom took me to the gynecologist and she said, well, why don't we just put her on birth control? And my mom said, well, don't we need periods? And she said, no, women in Europe go on birth control for their entire lives. We don't need to be dealing with periods as women. So I went on birth control for 3 years, and I really don't even remember why I discontinued it. And when I discontinued it, my period never came back. So then I got diagnosed with secondary hypothalamic amenorrhea, which is basically my hypothalamus, or the computer center in the brain that controls hormone production, shut down hormone production in my entire body. And so then I began the journey of hormone replacement therapy. And then I started dealing, I'd always been kind of fatigued. Like I didn't have the best energy. I wasn't out there getting after it in sports. But in high school, it was just, I mean, I couldn't sleep. I'd stay up till 2, 3 in the morning. I was exhausted. I wanted to sleep during the day, but I couldn't nap. So it was just the Walking Dead. And so that's kind of when everything came to a head symptomatically, as far as pursuing my dream of becoming an author goes. I had some more stuff after that that led to my actual diagnosis, but yeah.
So when did you ultimately get diagnosed?
I actually got diagnosed my last year of medical school. Took a
Okay.
long. Yeah.
So now you have all these sort of migrating symptoms, and you have all of these, diverse diagnoses for the various illnesses. At any time, during the course of all of these migrating symptoms and extreme diagnoses, did anybody ever say we can tie all this together, perhaps with a diagnosis of Lyme disease?
No, I think I was kind of checked for it. So a couple of things happened. I got, because of the secondary hypothalamic amenorrhea, I got sent to UCLA hospital, which is a teen care hospital. So I had an endocrinologist, and my mom had a lot of autoimmune conditions. So what they were saying was my ANA was positive. I didn't fit the diagnostic criteria for my antibodies that were high. I had scleroderma antibodies that were high, which is, of course, another very limey piece of the puzzle. But they were saying, well, we think there's some type of autoimmune thing. We don't know what it is. Then UCLA kind of got to a stuck point. You have a team, but you have a team lead. So my team lead left UCLA. The individual practitioners didn't know what to do with me. So ended up going to Mayo Clinic, and Mayo Clinic didn't know what to do with me either. Now, after I became a doctor, I went back and read my Mayo records just to see what they said, what I did, or what they had done. And I think they tested me for maybe Lyme antibodies, which we all know are infamously inaccurate, but that was probably the best guess anybody ever had at Lyme. And then actually, I did end up seeing, when I was in medical school, a functional doctor, and she screened me with CD57, but my CD57 was normal, so she just moved on from the Lyme diagnosis, and so it kind of fell through the cracks.
Okay. So you said you did get diagnosed your last year of medical school.
Yeah.
While you were in medical school,
Mm-hmm.
were you dealing with these different symptoms, and were you and your classmates and your professors discussing your illness? And did at any time during the early parts of your either self-diagnoses, classmate diagnoses, or professor diagnoses, consider Lyme?
Yeah, so this is actually a really interesting evolution. I'll rewind a little bit. So I graduated high school early and I was just so excited to get out. I did a little transferring, but I ended up getting my degree in biology from Cornell. So you probably have an appreciation for the older buildings that I lived in while back there. I mean, black mold on the walls
When
and
when you were at Cornell University?
oh yeah. I mean, and I lived in off-campus housing, so I'm not trash talking Cornell or anything like that. But they're old.
And it's one of the most beautiful campuses in the country. It's a beautiful, beautiful campus. And just coincidentally, my wife graduated from Cornell. So I spent a fair amount of time there.
Yeah, it's a great school, great place, but I lived in these older buildings that were not well maintained. And I mean, we had black mold just as part of our residence, and I didn't really know about mold illness back then. So I just felt really crummy the entire time I was there. I think I might have actually taken a gap year after I graduated before going to medical school. And at that time, I told my mom, I said, I feel like I'm dying because I would get up, I would eat breakfast, I would unload the dishwasher, and it would be like, I cannot do anything the rest of the day.
Yeah.
And, you've got naturopathic doctors telling me adrenal dysfunction, but that wasn't it. So I did see some other specialists during that time that were just not really helpful. Then I found this thing called the healing codes. I don't know if you've heard of it, but it's basically frequency medicine. And I didn't really notice a big symptomatic improvement with that, but that did lead me to my late mentor. He was an integrative rheumatologist and he had been a Stanford fellow and he had gotten really into basically triggers of chronic illness. He was into the whole hypothesis of hibernation genes being turned on in humans. So what turns on hibernation genes? So he had most of the puzzle. He knew about heavy metals. He did screened for porphyrins. He screened for parasites. But he didn't, he knew about Lyme, but he didn't really know as much about Lyme and mold as we do now. And he passed away before the information seen on that really shifted a lot. But he did help me stabilize me enough that I was able to go to medical school. But medical school was a rocky road. So my first year there, I had a really bad reaction to something in the cadavers we were dissecting. I mean, like that movie Hitch where he's all swollen. I mean, I was like that, but my whole body and in real life, much worse. I was getting steroid shots and prednisone packs. I was on Zyrtec and Pepsid and you name it, I was on it and they just could not get me stabilized. So I thought I was gonna have to leave school, but I did some high dose vitamin C IVs over a break and that got me stable enough. I was able to come back, but I never went back in the cadaver lab. I finished it online. So I had that. I mean, I wasn't the healthiest. Like I I was tired. I needed accommodations for my schedule. And then I had an episode of like unilateral paresthesias. So half my body went numb basically. So I went to the ER and they did the stroke protocol and of course nothing and they said anxiety attack. But I mean, I had literally just come from a birthday celebration for myself. I was fed, I was relaxed, I was happy, I was not anxious. And I was getting really bad lymphadenopathy after that. I called it my shoulder pads that would I literally looked like I had shoulder pads from swelling. And so the rheumatologist I was working with at the time, he was in a conversation with, I don't know if you know Dr. Charles Stratton. He's at Vanderbilt, but he specializes in chlamydia pneumonia. He's probably the leading researcher for chlamydia pneumonia in the world. And so my rheumatologist was really getting into reactivated chlamydia pneumonia at the time. So he diagnosed me with that. And we did a 5 antibiotic protocol with 5 antibiotics plus Valtrex on and off. And that was for a year and a half. That was a rough therapy. I mean, like full body aches. I would never know when I would just get so sick I wouldn't be able to move. A lot dry heaving on my way into class. And I kept going at my classes with some accommodations. And so I did that for a year and a half, and I kind of got to a point where I was feeling a lot better, a lot more functional. I'd lost some weight in a good way. But I didn't feel like continuing with it. I was getting any better. So we took a break And somewhere in that time window, I was getting recurrent. I think it started actually after the antibiotic protocol. So my guess would be a lot of the antibiotics I was on could also treat Lyme. So we probably cleared some Lyme, and that's why I felt better, but also maybe uh, brought it into a more replicative cycle because I started getting recurrent febrile illnesses. So I would get fevers, but I would get, a week on end, my whole body would ache and it would be tough to move around. I remember at one point it got so bad I couldn't turn my head. It was too painful. So I ended up getting, after I finished medical school, a mobility assistance dog to help me move around.
Let me ask you to hit the pause button there for a second. So when did you finally get diagnosed? Because you were getting past your diagnosis, and Presley's going to take you there, or
Mhm.
take you through that portion of the story. But give us a diagnosis. How did you get diagnosed with all of this?
Yeah.
Just getting, for folks who are not aware of Cornell University, for example. Cornell
Yeah.
University is an Ivy League school. It's one of the best schools in the country. It's on the East Coast. It's in New York, in the Lyme Belt. Cornell is right in the middle of Lyme Central, and you have all these symptoms. You're seeing medical professionals, but they're still not diagnosing you, even though you're right in the middle of the Lyme Belt. But you finally do get diagnosed when you're in medical school. So when did that happen, and how did you get your diagnosis?
Yeah, so actually, all the symptoms that I just described, I was experiencing before my diagnosis. I just gave that as a caveat to explain the severity, but all of this is leading up to my diagnosis. And then I was also living in a bunch of moldy places in San Diego because it's a coastal climate, and that's where I was going to school at the time. So, I actually went into, and I was kind of like, everybody knew that I had a lot of really complex health issues. And I decided to go into, we had a student clinic, and I decided to go in there because I had gained some weight. And I always gained weight when I had toxin exposures. And so I wanted help losing some of that weight. And I said, I don't really want to work on anything else. Oh, I also developed asthma during this time. So, anyway, kind of a respiratory recurrent hives, a lot of them MCAS type of symptoms started showing up at that time, hives, asthma. So I said, I just want to come in and I want to work on weight loss. And so they're kind of going through, they're doing that with me. And then one of my like colleagues, a student clinician, said, why don't we just check you for Lyme disease? So I was like, okay. And they did. And I came back, they just ran a Quest blot, and I was CDC positive criteria on the Quest blot. And I could not believe it that for so many years, like I didn't even need specialized testing. Someone could have just ran a Quest blot and we would have had an answer. So that was really shocking to me.
Okay, so Presley's going to take you through the treatment portion of this now that you have your diagnosis. But before Presley takes over, let me ask you one more question.
Yeah.
Um, how did you feel now that you finally have a diagnosis? Was it liberating? Was it exciting? Was it scary? Or was it a combination of all the above?
I think at first I was in shock. Like, how could I have lost? I wasn't expecting it because I was so used to everything looks normal. I was just kind of expecting that to happen again. And then I think after the initial shock, I was actually sad about it, because I was on Lyme clinical rotations then. I was reading Dr. Horowitz's book. I was trying to become a Lyme literate practitioner because I wanted to work with chronic illness and I knew that this was a big piece of it. And then so I knew how sick people got, and it wasn't, I mean, I was already probably as sick as a lot of them, but I think I just felt this overwhelm of, oh, now I have to deal with this and myself. And eventually I did get motivated uh to, okay, I'm gonna figure this out. I'm gonna figure it out on myself and I'm gonna get good at this. But it was shocking at first, actually.
Thank you for sharing that. I totally relate to that, and I think a lot of people do too. Before I want to get into the treatment, I wanted to ask you because I had the same experience where I was sick as a kid, and then at my high school, I was just like debilitated, and I had to do online too, and I graduated from being online. But the only reason I'm at college now is because I got diagnosed with Lyme at 14, and I was able to do treatment for like 4 years. So I was wondering how you went from doing high school basically online, isolated, to being able to go to college and be not completely better, but good enough to actually like be there physically.
I ask myself that question a lot. I think it was maybe just pure survival
Mm.
instinct. I don't know. I will say I don't remember a lot of what I learned. Like I look back at my academic time there and I think, what was I learning in those classes? I feel like I was a little bit dissociated in the classes or something because I felt so sick. But apparently I absorbed enough to pass and get through. And I mean, I definitely, getting into Cornell, I was obviously used to being a straight A student. I was not a straight A student at Cornell, but I got good enough grades to get through and to graduate. I didn't have to retake any classes. So survival and maybe probably a lot of God's grace would be my guess. I don't know. I don't know the answer to that question.
I wonder too, because I was looking on your Instagram a little bit and I see how much you do with women's health. And I've always wondered, like, if there's also just a correlation between the immune system and puberty and hormones. And once you get, like, to an adult, like 18, 19, 20, like you're kind of past that point of puberty for women. So I wonder if that has like an effect too on just like going to college and stuff, because I really made a shift in my symptoms. Like my last year of high school
For the better, for the worse.
for the better. And then I was able to go to college.
Yeah, I mean, hormones are immune regulating. I think it's different for everybody because they're immune regulating, but also with puberty, a lot of times we'll see activation of aberrant mast cell population. So I kind of think it depends on what an individual is dealing with.
Right. Okay. And I also just like want to say how amazing that is that you got through like biology degree at Cornell, because I'm doing a biology degree right now and like it's so hard, but I love it. But I mean, it's amazing.
Oh, thank you. I appreciate that. And hat off to you for pursuing that. That's really cool.
But I want to get into your treatment. So when you got diagnosed and then you were shocked and sad about it, then did you decide to take any action for treatment? And were you like excited to get into something that maybe would actually work, or like what were the steps you took from there?
Yeah, so I was very into antibiotic protocols at the time because I had done that one for chlamydia pneumonia, and that probably was the thing that had made the biggest difference in my health journey was this chlamydia pneumonia antibiotic protocol. I was also the shift that I was on learning about Lyme was really heavily influenced by Dr. Horowitz's work. And so I was like, I'm going to read his book, I'm going to learn the protocols, I'm going to do them myself, and this is how we're going to treat it. Well, um, I graduated med school and I was kind of delaying treatments until I passed my boards, and I was also training my service dog at the time. And so we were gonna send her away to get trained, and that didn't work out. So I ended up taking on training her with like a professional. But anyway, so I had a lot of big things going on. I had moved back in with family until I got my board. They were moving. So there's just a lot going on in my life. I was delaying treatment until we got past some of that. And I was using that time to learn a little bit more deeply about some of the protocols for it. Well, during that time, my sister actually got diagnosed with Lyme disease. So I have a sister who's 10 years younger than me. She had a lot of really similar health conditions to me, and including the IgA nephropathy. And the pediatrician basically said, you know, the nephrologist already told you guys there's no cure. Do whatever you're doing for Chelsea for her. So she had kind of been my little shadow symptom buddy, but because she had started some more holistic things earlier than I had, she never quite exploded as severely as it did. But she got diagnosed with Lyme. She was actually training, she was being groomed for the Olympics in her sport. She was a synchronized swimmer, and she got retired from her sport because of this Lyme diagnosis. And I wish I would have known more about Lyme then, because I think that would have not been necessary, but live and learn. So I was like, all right, we're gonna do antibiotics on her. And my mom said my mom just didn't want to do antibiotics with her for some reason. So my mom actually was praying about what to do with her. And this is kind of an interesting story. She had a dream that she took my sister to a clinic in California and they cured her of Lyme disease. So when she woke up, she looked up I think it was like the Genesis Clinic or something in the dream. So she looked it up and it was a real clinic in California and they actually treated Lyme disease. So she called them and she asked them what they did for Lyme therapy, and they told her about SOT. So that's how they learned about SOT. That's what both my sister and I ended up doing with. I will say I did a brief stint of low dose immunotherapy in the interim. And then I had my first flare reaction on that and put it aside and never revisited. I do offer that therapy in my clinic, but personally, I never finished up on it. So.
So did you see the biggest shift then after you did the SOT? And then if so, how long did that take? Because I know that they say sometimes it takes a couple months to see differences.
Yeah, for me, SOT was life changing. I mean, I've never experienced anything like it. I'm a holistic practitioner when it comes to Lyme. I give people their options, but I'm always in favor of doing SOT first. So I tried it on myself and my sister before opening up to patients. And so where I was symptomatically at that time, I was just the chronic fatigue has always been the worst thing for me, but it was that typical, I was working a job, but I remember just driving 20 minutes home at the end of the day. Sometimes I was just crying from how tired I was. And then walking from the car to the front door at the end of the day was just like a huge task. I was still getting the recurrent febrile illness where it's hard to move and where I would get the myalgias that were really limiting. I never I didn't exercise at all. And I continued to struggle with some of the recurrent hives and things like that. So that's kind of, oh, and insomnia. I had horrendous insomnia. So, I mean, when I was at Cornell, sometimes I'd sleep 2 to 3 hours a night. I mean, that's what my insomnia was like. And it pretty much carried with me until I treated for Lyme. It would take me hours to fall asleep. If I woke up in the middle of the night, I was awake for hours. So I started off with 4 different SOTs. I think I did two Borrelias. See if I can remember what I did. Two Borrelias and two Babesias, I think. Those are my main infections that showed up. And so I noticed actually differences right away. The first couple months, I had never been able to nap before. And what I realized is I started napping after that. And if I could take a nap in the middle of the day, I would, which it wasn't like a burden. It was like felt really refreshing. It was like I was finally getting some rest. Um, I did notice like a little kick up of my urine turned a little darker, so maybe a little flare of the uh IgA nephropathy when I was treating through it, but it pretty much went away after that. Um, and so and then I also noticed just kind of over maybe 6 months to a year, it was just this real gentle shift. It was like all of a sudden I could fall asleep within 30 minutes. Now I still had to take a bunch of natural sleep aids, but before that wouldn't do anything. And suddenly it was doing something. And then if I woke up in the middle of the night, I could actually fall asleep a little bit faster. I noticed my mood was just more even. Suddenly, 2, 3 o'clock used to be just a fight to stay awake. And I didn't notice that anymore. And then, so I let that go for a couple years. And then I did an Epstein-Barr SOT just this January and have noticed some positive results. And then I also started working on mold treatment and nervous system treatment kind of in between those SOTs. And those things also cleaned up a lot of symptoms for me.
That's great. I wanted to ask you two questions. I want to ask you how many SOT treatments you did over that time period of like 6 months to a year, and then also if you could maybe briefly describe what SOT is for the people who don't know.
Yeah, that's a great question. So I actually only did 4 SOTs during that initial 6 month period. So SOT stands for Supportive Oligonucleotide Therapy. The science behind it in the literature is called antisense therapy, and I just bring that out for those who like to read the literature. They can read about it under that name. And then the lab has kind of rebranded it as Q restraint therapy. So you might see all of those terms out there, and they're basically all responding to the same thing. And how that therapy works is we take a sample of the patient's blood and we send it to a lab in Greece they will find your specific infection. If they don't find your infection, they don't make it. So it's not like this nebulous, we think you have this infection. It's, we know you have this infection, we're going to go after it. And they genetically sequence that organism's DNA, focusing on the portion of the genome that is responsible for replication. And then they will make an RNA which we can give intravenously, that exactly binds the organism's DNA responsible for replication. It's not interfering with the human DNA. It's not causing protein synthesis, which we sometimes have concerns with RNA. It is silencing the organism's ability to replicate, and it sticks around for longer than the life cycle of the organism. And so, all organisms have a natural life cycle. The parent organism dies off, and then it can't replicate. And so you've done a significant job of clearing that infection with one IV, which is really remarkable. I will put the asterisk, I know that there's controversy about whether viruses are live or not. So we're blocking the replication of a virus at least long enough for it to be silenced. I'm not making any claims that we're killing a virus, if that makes sense.
Mm. That was a really good explanation. I also like that you mentioned the nervous system and limbic system work. I think that's almost beneficial for everyone. That was really helpful for me. I was wondering if you could share some nervous system and limbic system things that you did or that you recommend to your patients that you really see improve their health and immune functioning and even trauma processing.
Yeah, so I mean, I would say it all started when I finally broke free of this long-term narcissistic relationship. That was about halfway through medical school. And so I really just started with talk therapy. Um, and in that I would talk therapy, I think I had remembered by then this event of the sexual abuse. And, I had done some like prayer work around it. So I just really didn't know what to do. And it had like, I don't know, it helped some, but I didn't really understand the science of trauma getting stuck in your limbic system at that point. So the talk therapist I was going to said, I really think you need to go do EMDR if you are going to make progress in this. And so I was kind of against EMDR for a while because the toxic person that I was with was really, he kind of had this attitude about like he needed to fix me, and it just, so I wasn't, and he was suggesting EMDR, and so I wasn't really open to it. And then I started working with, when I graduated medical school, started working with another talk therapist, and he was, I mean, basically, if you can imagine Mr. Rogers as a counselor, and he told me, he suggested therapy called brain spotting, which is similar to EMDR. EMDR is trying to stimulate REM because one of the ways our bodies naturally process trauma is when we are dreaming. So when we're having this rapid eye movement. And so that's kind of the approach EMDR takes. Brain spotting is kind of similar, but it holds a spot. So instead of having eye movement, it holds a gaze spot that's connected to your limbic system and allows the brain to rewire. So I did that for a while, and I definitely noticed my responses slowing down. Um, and it did help, but I would always hit like a point where I couldn't go deeper. So then I actually ended up doing ketamine assisted brain spotting. I stayed mostly in psycholytic doses. Um, you can use it in psycholytic or psychedelic, and I do believe there's a place of psychedelics in medicine, but I think psychedelics kind of open us up to a spiritual realm, and we don't really know what we're getting into when we do that. And so I think we have to be careful with it. So I'm open to learning more about it. I think there's a place for it in medicine, but I don't know that I figured out quite what that place is yet. So I actually use the ketamine, which a lot of people with Lyme may be on just for pain. Ketamine is a dissociative anesthetic, and it basically dissociates you enough that you can move past the block that your frontal lobe will put up to going deeper into the limbic system. That helped me tremendously too. I noticed after that, I actually, when I treated the Lyme, I would wake up in the middle of the night, but I could fall back to sleep. When I did the nervous system work, I could actually sleep mostly through the night until 5 a.m. or so without waking up, which was really unheard of. Um, so that really helped. And then I continue to do spiritual, like I call it deliverance, spiritual deliverance work of just working on the spiritual aspects of healing as well.
That's amazing. I also did ketamine, and it was helpful in some ways, but like you were saying, like there are some like just things you want to be aware of with anything. It's hard when you're like kind of navigating it and like by yourself and stuff. I want to ask you if like you had any insights that you would share with your younger self when you were really, really struggling, or maybe for people who are listening who are like just in the deepest part of it and struggling the most, and just anything you can say that helped you, that gave you the will to get through and get better and then like eventually help others.
Yeah, I mean, I would think the first thing that comes to mind for me is just don't give up. I mean, if I look at my life now, I'm definitely still healing, but I look at my life like I ran a 5K this last Thanksgiving and I run a couple times a week. I exercise most days weekly. I go skiing. I mean, I would have never thought that I could have done any of that before. And so when I look at where my life is now, it's just amazing to me that I was able to heal that much. And I actually feel like I have hope of being like a kind of normal functional person, but also like strong and active and all these things that I always wanted to be, but I just never knew if I would ever get there. So I think don't give up is one of them. And like also fighting for yourself, like you got this, you know. I mean, I was really blessed too. My parents were definitely really supportive of me getting care, and I know that not everybody with chronic illness has that, but for some people, like some of my patients, I'm their community and I cheer them on, and so it can be a different type of relationship. um it doesn't necessarily have to be family, but someone who basically is like, hey, we're not going to give up until we find an answer, and there's one out there. And that's how I feel about my patients. You know, I tell them, I'm thinking about your case in the shower or when I'm driving, you know, I'm in it with you and we're gonna figure out an answer even if I don't know what it is. And I feel like you gotta have that attitude for yourself and find people who can have the attitude for you with you.
I think that's so important. That's really well said. And I know you mentioned that like you're trying to build your strength and kind of get back to more normal life and increase your resilience. And I know that Lyme is not really curable, or at least that's what a lot of evidence and literature says. But I mean, we coexist with microbes since like the beginning of time. So I was wondering if you have anything to share on kind of maintaining a stable and healthy body, mental state, and then maybe just continuing to like improve just with time.
Yeah. You know, there's something that I like to reference. I have it as a free download on my website. I call it my roadmap to healing, because I think it really simply ties together a lot of the different things you have to look at when people are dealing with chronic illness: nutrients, endocrine dysfunction, gut health, detoxifying, um, hormone health, cellular health, you know, all these different pieces that a lot of times when people get as sick as most of us on this call have been, all of those things have gone out of range. And so, and the other thing I like to remind people is, okay, let's say we get your Lyme titers to reverse, which I've seen that does happen with the SOT, and I've seen that with some other types of treatments too. um there are post Lyme changes that happen at a genetic level that we still need to work on. And so it's really just making, I think a lot of those things just go overlooked until somebody gets really sick, but a lot of us had predispositions for those things to go out of range in the first place. So if after we treat the Lyme, if we can keep working on those other things to keep them in balance, maybe to even put them back in a balance they never were at to begin with, but we just didn't know until everything went wrong at once, then we can be a lot healthier and a lot more resilient.
And how do you usually go about putting those things into balance? Is it different for everyone, or is there like some foundational things that you kind of recommend for everyone?
I mean, it's very individual. I prioritize. What I would say, it's very individualized because I prioritize. And one thing that I found that I think is different about the way that I practice versus a lot of other Lyme practitioners, as somebody who's been through it, there are a lot of really smart doctors out there, and I find a lot of times they're kind of throwing like everything up against the wall, and sometimes, I mean, it's not just overwhelming, but sometimes I think that's too much for what people with Lyme are, like too more than their system can handle. And so as somebody who's been through it, I do feel like this is something that I'm gifted at, is really kind of cutting through. Yeah, we need to work on 10 things, but what are the three that we need to work on for your survival right now? And so I do individualize it for everyone, but for everybody, there's some combination of getting their nutrients back on. Of course, we have to heal the gut to do that, getting their endocrine system back in balance, moving out any toxins that are present. So I'm in my what I would consider post Lyme, but I'm still working on toxins. We have to turn off the inflammatory pathways that got turned on. So I'm post Lyme, but I'm still working on MCAS because that got activated. And so I'm turning that off. I'm working on turning the mitochondria back on. So I like to do that in people post Lyme or during Lyme, but I think it's even more effective after post Lyme. So I'm still doing that. Like I still do rely on methylene blue to be as functional as I am. And those aren't forever things. But those are all things that still have to be addressed, even when the bug is cleared, dormant, killed, whatever.
That's very well said. And I also wanted to ask you, just as like a lot of people listening to this probably feel, health issues kind of just like put everything into perspective. And I wanted to ask you some life lessons or maybe things you learned about yourself that you found valuable that you want to share.
Yeah, I mean, this actually, I got a lot of purpose from going through this. And I mean, like, my personal belief is I don't believe that, like, it's God's intention for people to suffer, but I do think that He can bring good things out of that. And so I, when I say that, I don't want people to think like I think that this was like divinely inflicted on me for a purpose, but I do think that a lot of purpose came out of it. I love getting up every day and knowing that I can help people who don't have an answer and have people tell me, nobody even listened to me before. And sometimes just the healing power of listening and also just discovering kind of my own strength and resiliency. And, I know I kind of mentioned some of the trauma and the toxic relationship, but I think that was really interwoven with my illness and coming out of those things. I also was discovering who I really was, and so I feel like I also, through a lot of these experiences, I've taken a lot of identity. And I think that's something people who are really sick can appreciate, because you go your own path. People don't agree with what you're doing, they don't listen to you, they don't understand. A lot of times you're really isolated, and you just kind of learn, like, okay, well, who am I then? And who where does my value come from, and who do I actually answer to for the things that matter? And so discovering that was really impactful for me as well.
And I love that. Yeah. And I think a lot of people who get through this just have to find a sense of purpose of it. And some people, move on with their lives, some people give back, but either way, it just, when you come out of that, like it does definitely change like who you are. And I like what you said about the trauma. I think a lot of people underestimate how much like trauma impacts your chances of being chronically ill. Um, I also want to ask you, as we're kind of running low on our time, if you wanted to tell us a little bit more about your practice and if you're taking new patients and what that's like if someone wants to work with you.
Yeah, that would be great. So, as I mentioned before, I'm in Northern California. That's how I see patients brick and mortar. I also do see clients virtually. And so I don't take over for their primary cares that way, but I give a lot of adjunctive health advice and can really help them come up with a clear plan a lot of times for navigating these complex things. So I love working with Lyme, autoimmune, basically anything chronic. If you have a symptom that's been going on for a long time and you can't figure it out, then that is really what I love to work with.
That's amazing. And I think it's so you put it so well when you were like there's so much creative thinking and like even critical thinking skills and creative thinking skills. It's like a big puzzle piece. I definitely find that with studying biology, and I love a lot of creative stuff as well. And I know you're saying that you love creative writing. So I just appreciate that approach a lot.
Thank you. Yeah, I think it brings in like the human connection and really listening to the person in front of you. I think those are all things that are really overlooked in medicine. But they have led me to some missed diagnose or some diagnoses that have been missed in people before, just really sitting and listening and then also thinking creatively about things. So it's a I think a necessary and also interesting way to approach things.
Amazing. Those are all my questions, but Rich, Matt, do you have anything to
No,
add?
well, no, thank you. I mean, I do. We did have a strict time limit, so I thank you, Presley, for working within Dr. Azarcon's time limit. So um, I really appreciate both of you coming on and sharing your stories. This is a very powerful story and a very uplifting story. Um, I'm going to ask you one sort of final round of questions, and then we'll let you go. We began, you and I together, talking about the difference between allopathic doctors and naturopathic doctors. And one of the things that I wanted to explore with you is the difference between sort of the sort of find the bug and kill the bug philosophy that seems to be the allopathic philosophy, and this building the terrain philosophy that naturopathic doctors seem to be trained in. And do you believe that all of the experiences that you had during your childhood and then later, where your terrain kept getting beaten down by various events, is what led you to understand that the naturopathic path was the more appropriate path for you to develop your talents and then serve the community of sick people you're serving?
Yeah, I mean, I definitely think that played a role. And actually, you say that, and I remembered I forgot to say I had recurrent antibiotic use as a child too. So talk about knocking down the terrain. I mean, ultimately, I think I went into naturopathic medicine because I didn't feel like there were the answers that I was looking for at that point in time in conventional medicine. But as far as, terrain versus beat the bug goes, I feel like especially with chronically sick patients, it's a little bit of both. Because if you talk to somebody who has Lyme, I mean, some of us are never going to feel better than when we killed that bug. Or, like, for me personally, I wouldn't drink raw milk. I mean, I know I mentioned lactose intolerance, but beyond that, I know that it's supposed to help with the terrain. And that's why a lot of people like it. And I'm not saying this is a prescription for people listening, but I have had those, 1 in 1,000 infections that could kill you. And that's a germ that caused that, but it's in the context of the terrain. So for me, it's a little bit of both, right? I certainly don't think that you're going to get where you want to go by just killing and never addressing the terrain. And I had a patient that it really sticks out in my mind who's a good example of that because he had done I mean, so many different treatments for Lyme. You name it, he tried it. And his labs, he actually had seroconverted some. So when I looked at his labs, I said, it looks to me like you used to have Lyme and that it's not active anymore. But he was so sick. I mean, he was still so sick. And I think part of that was the impact the antibiotics had on his mitochondria. He also had a lot of mold and toxins and things in his system still. So he was still sick because of the terrain and not necessarily the bug.
Well, but can't we also be symptomatic if our neural pathways have been changed, even if it didn't necessarily affect our mitochondria, and even if it didn't necessarily affect our body in that way, it is still possible that the neural pathway changes that occur as a result of either having the bugs in your brain, or because of the inflammation, or even because of the gaslighting that so many patients like you had to deal with, could cause you to still be symptomatic. And if we're just focusing on the bug and we're not focusing on the terrain, it almost seems like it would be impossible for folks to overcome certainly these post-infectious symptoms.
Yeah, absolutely. And I think that's a really great point too, where that's where some of the nervous system work comes in as well, is also rewiring your brain to wellness, because illness can become an identity and all consuming and the only thing. And yeah, and your brain just has to learn new pathways too.
Right, your brain is going to develop pathways or shortcuts that are going to serve you while you're sick. And then when you're no longer sick and you no longer need those pathways, unfortunately, you have to go through a process of changing those pathways. And that's one of the reasons why I think naturopathic doctors are better equipped to deal with these challenges, because in many cases, even if the practitioner is successful in clearing the bugs, and I think you and Presley and I would probably debate about whether or not that's even necessary, but let's assume for the purposes of this limited part of our conversation that the bugs need to be cleared and are cleared. Many people still remain symptomatic,
Yeah.
and that's because their brain is designed to protect them from from the moment when they're chronically ill, and then when the foundation of the chronic illness, whether it be the bugs or the impact that the bugs are having on your immune system, is no longer in place, many patients still remain sick.
And I think that could be possibly the most important point of this whole podcast, because I do see that mistake being made where people, they got a Lyme diagnosis, and so they just assume I'm still sick from Lyme, and they just go after the Lyme, the Lyme, the Lyme, the Lyme. And sometimes it's not the Lyme anymore. Sometimes it's other stuff that you need to look at. And I'll look at their labs and go, you have enough other stuff going on that I can tell you it makes sense you're feeling sick, but your Lyme looks okay. And yet, like, maybe at some point that was the thing that made sense to them, and so it just sticks. And yeah, that's such a good point.
Well, part of it is that I think it makes sense is because we've all been conditioned for that to make sense because we've been raised in the allopathic medical community, right? And because the allopathic medical community is really based on germ theory and it's find and kill, and that's, by the way, very, very effective in most cases with acute illnesses. But because we've been conditioned and educated to believe that, that's the prism that we look at our illness through. And that is not a prism that will serve you if you are trying to overcome a chronic illness. It's just simply not.
Yeah, absolutely. I agree.
All right. So again, thank you so much for taking time away from your practice and from your family and from all the other commitments that you have. We would really love to have you back for a more detailed conversation at some point in the future. But thank you so much for again serving our community with all of the great information you've given us. And Presley, thank you so much for your brilliant questions. And I really love the interaction between the two of you. It really was fantastic.
Yes, thank you for
Yeah.
coming on here to talk. I love listening to everything you had to share, and thank you for having me, Rich.
Yeah, thank you so much. I feel really honored to be here, and I just love what you guys are doing. So thanks for helping me be a part of that.